Welcome to SATU Career 2.0 online nursing channel. In today's video, we are going to see another 20 important questions for the upcoming nursing officer exams. So these 20 questions will be very useful for you not only to the AIMS nursing officer exam, it will also be help in any other nursing officer exams which you are going to give in future. So watch all the 20 questions without skipping the video. Before that, please subscribe to our channel and click the bell icon to get the latest notification about all the videos related to any exams like JIPMER, NIMHANS and all the AIMS nursing officer exams. So let's see the first question in this video. Mr. Bhatia, who has recently traveled to Mumbai, comes to the emergency department with increasing shortness of breath and is strongly suspected of having a COVID-19. Which of these prescribed actions will you take first? The right answers you have to choose from these four options. Option A, place the client on a contact and airborne precautions. Option B, obtain blood, urine and sputum for cultures. Option C, administer methylprednisolone 1 gram IV. Option D, infuse normal saline at 100 ml per hour. So the right answer for first question is option A. We need to place the client on contact and airborne precautions. The rationale, since COVID-19 is a severe disease with a high mortality rate, the initial action should be to protect other clients and healthcare workers by placing the client in isolation. Move on to question number 2. Knowing that gluconeogenesis helps to maintain the blood glucose level, a nurse should option A, document weight changes because of fatty acid mobilization. Option B, evaluate the patient's sensitivity to low room temperature because of decreased adipose tissue insulation. Option C, protect the patient from sources of infection because of decreased cellular protein deposits. Option D, do all the above. So the right answer, very simple, the nurse should do all the above mentioned activities. So during gluconeogenesis, the glucose is going to be produced from the non-carbohydrate sources like fats and proteins. We need to be very careful about all these things and we need to do all the mentioned actions in option A, B and C. So now let's see the third question. A client with diabetes mellitus has a prescription for glucotrol XL, that is glipizide. The client should be instructed to take the medication. Option A at bedtime, B with breakfast, option C before lunch, and option D after dinner. So glipizide is the medication taken during breakfast. Option B is right. The rational glucotrol XL is given once a day with breakfast. Answer A is incorrect because the client would develop hypoglycemia. When you give this drug at bedtime, the client is going to develop hypoglycemia. And answers C and D are incorrect because the client would develop hypoglycemia later in the day or evening too. Now let's see the fourth question. The diagnostic workup of a client hospitalized with a complaints of progressive weakness and fatigue confirms the diagnosis of myasthenia gravis. The medication used to treat myasthenia gravis is option A, pyridostigmine, B, atropine, C, didronol, option D, tensilon. So the drug which is given to treat myasthenia gravis is option A, pyridostigmine is right here. The rationale very simple. Pyridostigmine is used to treat clients with myasthenia gravis. Answer B is incorrect because it is used to reverse the effects of neostigmine. The atropine is used to reverse the effect of neostigmine. Option C is incorrect because the drug is unrelated to the treatment of myasthenia gravis. Answer D is also incorrect because it is a test for myasthenia gravis. penicillin is not a drug, it is a test for myasthenia gravis. Now let's see the question number 5. At the 6-week checkup, the mother asks when she can expect the baby to sleep all night. The nurse should tell the mother that most infants begin to sleep all night by age. Option A at 1 month, B at 2 months, option C by 3 to 4 months, option D 5 to 6 months. Most of the newborn babies start sleeping all night at the age 3 to 4 months. Option C 3 to 4 months is right. Most of the infants begin nocturnal sleep lasting 9 to 11 hours by 3 to 4 months of age. Answers A and B are incorrect because the infant is still waking for nighttime feedings. Answer D is incorrect because it does not answer the question. Now let's see the sixth question. A nurse instructs a preoperative client in the proper use of an incentive spirometer. Which does the nurse use to determine that the client is using the incentive spirometer effectively? Option A, cloudy sputum. B, shallow breathing. Option C, unilateral wheezing. Option D, productive coughing. So when the patient is using the incentive spirometer effectively, what the nurse can expect in this four option? The right answer the nurse can expect for productive coughing if the patient is using the incentive spirometer correctly and effectively. The rational incentive spirometer will help in reducing atelectasis and it opens the airways, stimulates coughing and helps to mobilize the secretions for expectorations via vital client participation in recovery. Cloudy sputum, shallow breathing and wheezing indicates the incentive spirometer is not working effectively. Now let's move on to seventh question. The question here, a child is admitted to the pediatric ward with a diagnosis of celiac disease. Based on this diagnosis, the nurse expects that the child's stool will be option A, malodorous, option B, dark in color, option C, unusually hot, option D, abnormally small in amount. So in celiac disease, what will be the characteristic of the client's tool? The right answer, option A, malodorous. So what does mean by malodorous? In celiac disease, the disorder in which the child has intolerance to gluten, the protein component of wheat, barley and oats. The stools of a child with celiac disease are characteristically malodorous, pale, large, bulky and soft. Excessive flatus is common in celiac disease and bouts of diarrhea also may occur. Bad word, malodorous. So option A is right. Question number 8. A clinic nurse is caring for a client with a suspected diagnosis of gestational hypertension. The nurse assesses the client expecting to note which of the following if gestational hypertension is present. Option A, edema, ketonuria, obesity. Option B, edema, tachycardia and ketonuria. Option C, glycosuria, hypertension and obesity. Option D, hypertension, edema and proteinuria. So when there is a suspect for gestational hypertension, we need to assess and we need to expect for the symptoms like option D is right, hypertension, edema and proteinuria are common symptoms during gestational hypertension. The rational gestational hypertension is the most common hypertensive disorder in pregnancy. It is characterized by the development of hypertension, proteinuria and edema. Glycosuria and ketonuria occurs in diabetes mellitus, whereas tachycardia and obesity are not specifically related to the diagnosis of gestational hypertension. Now let's see the ninth question here. A client who undergoes gastric resection is at risk for developing dumping syndrome. The nurse monitors the client for option A dizziness, B bradycardia, C constipation, D extreme thirst. In dumping syndrome due to gastric resection, what the nurse will monitor in the client? The right answer, option A, dizziness. The nurse has to monitor for dizziness. The rational dumping syndrome is a rapid emptying of the gastric contents into the small intestine that occurs after gastric resection. Early manifestations of dumping syndromes occurs 5 to 30 minutes after eating. The symptoms includes vasomotor disturbances such as dizziness, tachycardia, syncope, sweating, pallor, palpitation, and the desire to lie down. So this is all about dumping syndrome symptoms. So initial problem, the nurse should monitor for dizziness. Question number 10. A client with heart failure was experiencing difficulty breathing and increased pulmonary congestion. The physician prescribed furosemide, that is lac 640 milligram, to be given intravenously, and it was given an hour ago by the nurse, which indicates that therapy has been effective. So in heart failure, they are giving the Lasix, and from these four symptoms, find out which indicates the therapy is effective. Option A, the lungs are now clear to auscultation. Option B, the urine output has increased by 400 ml. Option C, the serum potassium level decreased from 4.7 milliequivalent per liter to 4.1 milliequivalent per liter. Option D, the blood pressure has decreased from 118 by 64 millimeter of mercury to 108 to 62 millimeter of mercury. So here we need to see that the Lasix do all the activities, all the actions as mentioned here. But related to the patient condition, if you see, the option A will be the right. The lungs are now clear to auscultation. Now the rational furosemide is a diuretic. In this situation, it was given to decrease the preload and reduce pulmonary congestion and associated difficulties in breathing. Although all options may occur, option 1 is the reason for the administration of furosemide. So this is about the 10th question rational. Now before seeing the 11th question, we are guiding all the aspirants for the success in the nursing officer exam through various social medias like WhatsApp, Telegram, and Facebook. The link for all the three social media will be given in the description box. If you like, you can join and you can get the preparation guidance service in free of cost. Now let's see the 11th question. Skin closure with heterograft will be performed on a client with a burn injury, and the client asks the nurse about the meaning of heterograft. The nurse tells the client that the heterograft is from option A cadaver, B, another species, C, the burned client, D, a synthetic source. So heterograft is the thing which we are taking from. The skin is taken and kept in a person from another species. Option B is right. Now the rational, you know very well, biologic dressings are usually heterographed or homographed material. Heterographed skin is taken from another species. The most commonly used type of heterographed is pig skin. pig skin because of its availability and its relative compatibility with the human skin. Now, the 12th question. The nurse is scanning for a client admitted to the hospital after sustaining a head injury. In which of the following positions should the nurse place the client to prevent increased intracranial pressure? Option A, in left Sims position. B, in reverse Trendelenburg position. Option C, with the head elevated on pillow. Option D, with the head of the bed elevated at least 30 degree. So to prevent increased intracranial pressure for a client who is having head injury, the nurse should place the client in option D. The head of the bed should be elevated at least 30 degrees. The rationale: the client with a head injury is positioned to avoid extreme flexion or extension of the neck and to maintain the head in the midline. Neutral position: the client is log-rolled when turned to avoid extreme hip flexion. The head of the bed is elevated to at least 30 degrees or as recommended by the physician. Therefore, options 1, 2 and 3 are incorrect here. The 13th question. A newborn is diagnosed with esophageal atresia. The nurse assesses the infant, knowing that a typical finding in this disorder is option A, slow reflexes, B, continuous drooling, option C, diaphragmatic breathing, option D, passage of large amount of frothy stool. So in esophageal atresia, which is the typical finding, the nurse should note. The right answer option B, continuous drooling of saliva. The rationale: in esophageal atresia, the esophagus terminates before it reaches the stomach, ending in a blind pouch. This condition prevents the passage of air, swallowed mucus, and saliva into the stomach. After fluid has accumulated in the pouch, it flows from the mouth and the infant then drools saliva continuously. Now let's move on to the 14th question. The nurse is determining the need for suctioning in a client with endotracheal tube attached to a mechanical ventilator. Which observation by the nurse indicates this need? Option A, clear breath sounds. B, visible mucus bubbling in the endotracheal tube. Option C, apical pulse of 72 beats per minute. Option D, low peak inspiratory pressure on the ventilator. So which of the following observation done by the nurse makes the nurse to do suctioning to the client with endotracheal tube? The right answer, visible mucus bubbling in the endotracheal tube. Option B, this observation, if it is present, then we need to go for suctioning. The rational indication for suctioning includes moist wet respirations, restlessness, bronchial auscultation of the lungs, visible mucus bubbling in the endotracheal tube, increased pulse and respiratory rates, and decreased peak inspiratory pressures on the ventilator. A low peak inspiratory pressure indicates there is a leak in the mechanical ventilation system. 15th question. The nurse is preparing to administer a Montax test to a client. The nurse determines that which area is most appropriate for injection of the medication. Option A, dorsal aspect of the upper arm near a mole. Option B, inner aspect of the forearm that is close to a Bell's scar. Option C, inner aspect of the forearm that is not heavily pigmented. Option D, dorsal aspect of the upper arm that has small amount of hair. So the right answer, the Montax test is given option C, inner aspect of the forearm that is not heavily pigmented. The rationale here, intradermal injections are most commonly given in the inner surface of the forearm. Other sites includes the dorsal areas of the upper arm or the upper back beneath the scapula. The nurse finds the area that is not heavily pigmented and is clear of hairy areas or lesions that could interfere with the reading of the results. Next question. A hospitalized client is dyspneic and has been diagnosed with left tension pneumothorax by a chest X-ray. After insertion of a central venous catheter, which of the following observed by the nurse indicates that the pneumothorax is rapidly worsening? Option A, hypertension. Option B, flat neck veins. Option C, pain with respiration. Option D, tracheal deviation to the right. Tracheal deviation to the right. Now, the right answer to be found for this question, there should be a tracheal deviation to the right side. That is the exact observation nurse should notice in this client. The rationale, a tension pneumothorax is characterized by distended neck veins, displaced point of maximal impulse. Now, the tracheal deviation to the unaffected side, asymmetry of the thorax, decreased absent breath sounds on the affected side, and worsening of sinuses. The increased intrathoracic pressure will cause the blood pressure to fall, not to rise. The client could have pain with respiration. So the right answer, there will be a deviation of trachea. That is the option D is the right here. Now let's see the 17th question. When assessing the urinary output of a client who has had extracorporeal lithotripsy, the nurse can expect to find option A, cherry red urine that gradually becomes clear. Option B, orange tinged urine containing particles of calculi. Option C, dark red urine that becomes cloudy in appearance. Option D, dark smoky colored urine with high specific gravity. So, end of the extracorporeal lithotripsy, the nurse should expect for cherry red urine that gradually becomes clearer. The rationale following the extracorporeal lithotripsy, the urine will appear cherry red in color but will gradually change in color to clear urine. Answer B is incorrect because the urine will be red, not orange. Answer C is incorrect because the urine will not be dark red or cloudy in appearance. Answer D is also incorrect because it describes the urinary output of the client with acute glomerulonephritis. Now move on to question number 18. The physician has prescribed Cognex, that is Tacrin, for a client with dementia. The nurse should monitor the client for adverse reactions, which includes option A, hypoglycemia, B, jaundice, option C, urinary retention, option D, tinnitus. So, when the patient is taking Cognex, the side effect will be option B, jaundice. The rationale, it is adverse reaction to the Cognex when it will induce a drug-induced hepatitis. The nurse should monitor the client for signs of jaundice. Answers A, C, and D are incorrect because they are not associated with the use of Cognex. Question number 19. Which finding is the best indication that a client with ineffective airway clearance needs suctioning? Option A, oxygen saturation. B, respiratory rate. C, breath sounds, D. arterial blood gases. So which is the best indication for the nurse to maintain a clear airway by doing suctioning? The right answer, the breath sounds are taken as the clear indication which needs the client for suctioning due to ineffective airway. That is the rationale for option C. Any changes in the breath sounds are the best indication of the need for suctioning in the client with ineffective airway clearance. Answers A, B, and D are incorrect because they can be altered by other conditions. The 20th question. A client with tuberculosis has prescription for myambutal, that is etherbutyl hydrochloride. The nurse should tell the client to notify the doctor immediately if he notices. Option A, gastric distress. B, changes in hearing. Option C, red discoloration of body fluids. Option D, changes in color vision. So when the client is taking myambutal for treatment of tuberculosis, the nurse will notify there is any changes in color of vision that should be noticed to the physician immediately. The rationale, an adverse reaction to myobutal is change in visual activity or color vision. Answer A is incorrect because it does not relate to the medication. Answer C is incorrect because it is an adverse reaction to streptomycin. Answer C is incorrect because it is a side effect of rifampicin. So these are the important 20 questions which we have covered today. Yesterday also we have covered the 20 questions. If you have not seen that, you can click the video which is showing here and you can watch it. Thanks for watching this video, and please comment about this video, like this video, and share this video with all your friends, and subscribe to our channel Sathish 2.0 online nursing channel, and meet you again with another 20 important questions. Till that, take care, bye bye, stay alert, stay safe.